Breaking tonight, new reaction to our lead story in the middle of a two-day debate over the Obamacare website, how well it's working now, and whether we should trust the administration's claims. We got new sound tonight from the #2 Republican senator lashing out at the Obama administration. Listen.
I think the current administration has taken lying to a new level. To me, that's the one thing that I find most aggravating about what's happening in Washington these days, and particularly about this administration, which is a lack of accountability and the willingness to mislead people or provide them just demonstrably false information and expect to be able to move on. We've seen that most recently in the health care debate over if you like what you have, you can keep it, something that we can go back to 2010 and demonstrate that the Department of Health and Human Services knew was false.
Joining me now, Ben LeBolt, founding partner of the Insight Agency, which is a strategy firm, and National Press Secretary for Barack Obama's 2012 presidential campaign. Ben, good to see you. Thanks for being here.
Thanks for having me, Megan.
Let's start with that, with John Cornyn suggesting that this administration has, quote, taken lying to a new level.
I think the senator's comments were misguided and unfortunate, and I think that Republicans have been rooting for the failure of the Affordable Care Act rather than taking steps to strengthen it. The president apologized to the American people for saying that if you like your plan, you can keep it. And I think that was refreshing. That's something that Americans didn't see from the prior administration when there was a credibility issue at stake. What he should have said. He didn't really
apologize for that. He said, "I'm sorry that you find that people are finding themselves in this situation because of something that I said."
Well, I think that ultimately what he should have said was that many plans in the individual market are inadequate. They drop your coverage if you get sick,
okay,
and the fact is...
But let me stop you there, because we've had the debate about what the president should have said. What he is saying, what Senator Cornyn is saying, is that it was all lies, that this administration has been misleading, and that there's no accountability for the misleading. You were with Barack Obama for all of 2012, helping push his re-election, and health care was a major issue.
That's right.
Were you present for any discussions about this line, about people being able to keep their health insurance plans?
I worked for the president beginning in 2007 all the way through the re-election campaign, and reforming health care was a key topic. I got to tell you, we tried every day to get everything that we said and that the president said right. It went through a research vet. It went through a policy vet. We were scared to death that we'd get something wrong. We vetted everything. There's an incredible amount of churn in the individual health care market.
But you're not answering my question. Was this line in your, because there have been lots of reports about Barack Obama's, advisors and so on being present, and whether the policy people, the report from the Wall Street Journal was that the policy people said the president can't go out there and say this. If you like your plan, you can keep it. Because it's not true. And that the political people said, keep your mouth shut because your actual statement is not that saleable. That's what the Journal reported.
I never discussed it with him, and I don't ever recall having that discussion. Having talked to some of the people involved subsequently, what I know is that there's an incredible amount of churn and change in the individual health care market. These plans change over year after year after year. And so what Republicans have tried to do is blame the Affordable Care Act for all of the inefficiencies that exist in the health care market today. Ultimately,
it's not just
we preserved the private market,
the
pre-existing
head of
market.
The insurance group, Karen Ignami, forgive the pronunciation of her last name, came out and said the reason these policies are being canceled is because of the Affordable Care Act. The insurance companies that are in partnership with the White House and the administration on this, they specifically say the reason these policies are being canceled is because of Obamacare.
They were weak policies that now need to meet a higher standard. They can't kick people off anymore because they have a pre-existing condition or set a lifetime cap on their coverage. And so they now have to meet that higher standard. And those Americans...
You're dodging
no, but I'm not. Those Americans who are being dropped from these plans will now be offered stronger plans. And in fact, 70% of people on the 70% of people on the individual market will qualify for subsidies or Medicaid coverage that gets them a stronger plan. But why are they being dropped from them? That
goes back to whether this was a lie. Because the president came out and said, if you like your plan, you can keep it, period. And then now the insurance companies have come out and said, that's not true. The only reason we're dropping people from these plans is because of Obamacare. And your response is, those were crappy plans.
The president has acknowledged that statement didn't clearly communicate what he wanted to communicate to the
was it a
American people,
lie?
which is
That
that they
seems to be
now
what
have
Senator
the
Cornyn is
opportunity
saying.
to enroll in stronger plans. And I think that the president specifically addressed that and addressed that he misled people. And the administration is working every day to regain credibility. The ultimate test of this is going to be, are people satisfied with their plans? There are reports today that 4 times the number of people who signed up to enroll in October signed up in November. In states that set up individual
Well, it was only
exchanges,
27,000 in October.
But the reports today said 100,000 now, and we've seen a lot of success.
I realize that,
in
Ben, but
states
you're
that
trying to
set
get
up their
7
own
million by
healthcare
March, so
exchanges.
let's not mislead the
Well, that
viewers
was-
into thinking this is some
that was-
astronomical number.
That was the Congressional Budget Office projection. The goal for the administration is to make sure that the right set of people enroll, to keep premiums down, to
Right.
make sure that the majority of people see lower premiums, like the Congressional Budget Office
I got that.
projected
I got
they
that. We
would.
talked about that earlier, how that's the key, that the people have to get on healthcare.gov. They have to see lower premiums or subsidies
right.
to help them with. And if that happens, that could help a lot. That's what the
right.
law's defenders say. But let me ask you about this issue of credibility, because David Plouffe, who you worked with as well, came out and said, look, that people trust this president. And right now, you know, the latest polls suggest not really. The majority don't, or at least it's extremely close. Your partner in this strategy firm is Robert Gibbs. So he was formerly the White House spokesman. And he has come out and been very frank about his belief that this administration needs to hold someone accountable for the deterioration in trust we've seen, that somebody needs to get fired, basically. You agree with that?
He has, and I think ultimately we will see accountability here. I think the real accountability is, have we put in place a system that ensures that the program works?
No, it
and the
isn't.
administration has taken
Come
steps to
on.
do that, isn't
Ben,
it?
you don't believe that.
They've brought in tech specialists from Silicon Valley.
Stop that.
They've brought in a
Come on.
world-class management expert to make this work. And I think we're seeing them take steps to ensure accountability.
Now stop that, because you're too smart to believe that. That real accountability is when the disastrous rollout is turned around and the system starts working beautifully. I'm asking you about accountability for the disastrous rollout.
Well, what would
and
you
for-
like to
for
see,
the broken
Megan? How do you
promises.
define it? What would you like to see?
Yeah, I don't care. It's not up to me. I'm just saying,
Isn't
don't
the
tell
test
me
of
that
success
accountability
whether
for
or
all the
not the
mistakes is to
system
fix the
allows
mistakes.
people to enroll
Accountability
in
is to say,
quality
you
plans?
screwed up, and here's the person. I don't know who it is. Is it Kathleen Sebelius? You tell me. Is it the person who runs, Medicare and Medicaid? You tell me.
I don't think it's
who
going
is
to come down
responsible?
to. Here's the deal. I don't think it will come down to any one person. There were 55 contractors involved in developing this. I think there's a problem
Who was
that
their
55
boss?
contractors were involved in the first place.
Who
and
was their
I
boss?
think,
Because
I
one of
think
those
that's why it
architects
was a
of
great
Obamacare, David
decision to
Cutler,
put
came
Jeff
on.
Zients in charge of
Listen,
the
Ben,
management
let me get this in.
of
Let me get this in. I'm
implementation.
going to give you the floor. But David Cutler, one of the architects, came on and said, and you know this because he wrote a public letter to the administration back in 2010 to Larry Summers, who was advising. And he said, listen, I want Obamacare to survive, to succeed. I'm one of the architects, but you got to have a CEO running this thing. And I don't think the people advising the president are going to, we can count on them. And I see disaster coming. And he was blown off. So the question now is whether there should have been a CEO and who made the decision not to have one. Should somebody be fired? I mean, Robert Gibbs, your partner, says somebody should be fired.
Listen, I agree that there should have been a CEO. I think there is a CEO in charge right now in the person of Jeff Zients, who's putting out these daily reports, who issued this progress report, who we've seen the turnaround of the website under. I think that is going to be a successful model moving forward, and I think it should have happened in the first place.
It's good having you on.
Thanks for having me.
It's good to see you. All right, Ben, all the best. Hope you come back.